So good morning, everybody. My name is Victoria Maizes, and I am the Executive Director of the University of Arizona Andrew Weil Center for Integrative Medicine, and I'm so glad that you could join us today. We're also very grateful to the University of Arizona Global Initiative, who is the host of this webinar series. And we welcome everybody who is joining us this morning, including all of our international collaborators. This morning, we have a wonderful team of faculty from the University of Arizona who will be giving talks about what we can bring from integrative medicine to help us as we are in the midst of this coronavirus pandemic. So before we begin, I did want to tell you just a little bit about the Andrew Weil Center for Integrative Medicine. As you can see on the slide, our vision is to inspire the pursuit of health and the transformation of healthcare. And one might argue that we need this today more than ever. We need us to be as healthy as possible so that, one, we could hopefully reduce the risk of contracting this virus, and we also need it so that if we do contract the virus, we can have a healthy immune system that deals with it as well as possible. And clearly our healthcare system needs some transformation to be able to address the kinds of issues that we currently face. Our mission is to lead the transformation of healthcare by training a new generation of health professionals and by empowering individuals and communities to optimize health and well-being through evidence-based, sustainable, integrative approaches. And I think that's what you will learn today. You will learn some approaches that hopefully will allow you to take additional steps beyond the public health steps you've heard to help you be as healthy as possible. So we do want you to know that our center has put up a special webpage, and you'll get the link both in a moment but also at the end of this webinar with COVID-19 resources and also with a frequently asked question page. We want you to know that we have a wide range of educational programs, from a 2-year fellowship in integrative medicine that trains about 160 physicians a year to a program that gets embedded into residency programs called Integrative Medicine in Residency. We train allied health professionals through our iHelp program and our coaching program. We have rotations for medical students in residence, and we also have a wide range of online courses that have CME and CE, many of which we've made free during this coronavirus pandemic. So our purpose as a center, as we think about what we uniquely have to offer during this pandemic, is threefold. The first is, what does integrative medicine have to offer in terms of immune function that could help us as we face this virus? And today's webinar is one part of our approach to addressing this important question. Another is an article that we published on March 26th. Lise Alschuler was the lead author, and she will be speaking today. And as you can see, many of the other authors are on this panel as well. And then there is our COVID-19 resource page with a wide range of resources, from dietary supplements that you might think of to stress management to many of the other things that people are wrestling with. The second thing that we are addressing as a center is, how can we educate health professionals who have had their rotations canceled or have been quarantined because they have the infection or they've been exposed to the infection? And so to address this, we rapidly changed our rotation, which was a live rotation for medical students and residents, from an in-person to a virtual, and we've added 2 more rotations for medical students and residents. We also have begun to offer a shorter course, Integrative Medicine Skills in Residency, which is a 12-hour educational program to residents and to residency programs that are scrambling to find content for their residents during this time. And we have multiple free online courses for all health professionals. And finally, we want to support the public with resources to help them address the questions they have about this pandemic and also the stress that all of us are feeling. So the website, we have podcasts that have been developed by our faculty, the courses. We also have developed an app called My Wellness Coach and released it for free. And it has integrative medicine approaches to leading a healthy lifestyle in both English and Spanish, iOS and Android. And finally, we're using our social media platform to get the word out about integrative approaches. So I'm so delighted to be introducing our speakers. Our first speaker in many ways needs no introduction. He's widely known as the father of integrative medicine. He's internationally renowned, and he's also the founder and director of the Andrew Weil Center for Integrative Medicine and a professor of medicine and public health, Dr. Andrew Weil. Our next speaker will be Dr. Randy Horwitz, who is our medical director. And he has also, in addition to going through medical training, gotten a PhD in molecular immunology. And if there's ever a time when we need immunologists, it is now. So Randy will be our second speaker. Our third speaker will be Dr. Lise Alschuler, who is a professor of clinical medicine at the University of Arizona and the assistant director of our fellowship. And she is internationally known for her expertise in dietary supplements, and that's what she'll be covering today. Our fourth speaker will be Dr. Esther Sternberg, who is research director at the Andrew Weil Center for Integrative Medicine and also the founding director of the University of Arizona Institute on Place, Wellbeing, and Performance. And she'll be speaking about how to manage stress and the effect of stress on our immune system, as well as how to make your home a healing space so that as we spend so much time at home, it is time that helps nourish us. And lastly, Dr. Anne-Marie Chiasson will be joining me in moderating the questions that come up at the end. Dr. Chiasson is the director of our fellowship and an associate professor of medicine at the University of Arizona. So now I give you our founder and director, Dr. Andrew Weil.
Thank you, Victoria. Good morning. I'm going to make some general remarks about integrative medicine and infectious disease and pandemics. One of the great thrusts of integrative medicine is to promote health, to optimize health and reduce disease risks. And we do that by emphasizing healthy lifestyle choices. One of the principles that I've seen over and over in my career and in my research is that healthy organisms are naturally resistant to infection. I've seen this in plants, I've seen it in animals. One demonstration I saw, field of soybeans, the same genetics. One half of the field had good nutrients in the soil, the other was deficient in various nutrients, and there were predatory insects, and the predation on the nutrient deficient plants was much, much greater than that on the well-nourished plants. So this is, I think, a general principle of health, that if organisms are healthy, they tend to be naturally resistant to infection. So I think one of the things that integrative medicine has to offer here is all that we know about how lifestyle choices, and including choices we make in the mental emotional realm, affect immunity and our natural resistance. I have long advocated an anti-inflammatory diet as being the best strategy for overall health and longevity. You can find the details of that on my website, drweil.com. I recommend regular physical activity, and others can talk about that, proper rest and sleep. But I also am very interested in how mental and emotional states affect immunity and natural resistance. I think in this present era, one of the pieces of advice that I would give is to be careful about the amount and kind of news that you let into your consciousness. I think television news can be particularly upsetting at the moment, and I really advise limiting exposure to that. You know, obviously you want to stay informed, but I think there's a real danger of paying attention to news in an addictive way, and that I think has negative effects on our emotions. Dr. Sternberg can speak more to this, but it is very clear that stress lowers immunity. And it, as I think, is very important to learn and practice methods of neutralizing harmful effects of stress. I recommend simple breathing techniques as being the most time and cost effective. in particular the 478 breath that I've long taught. You can search on YouTube for 478 breath under my name, and you'll find videos of me demonstrating it. This is something that just takes a few minutes a day, and I think is very, very effective as a practice to neutralize harmful effects of stress. Laughter has a very salutary effect on our natural resistance. I've been very delighted to receive from friends in many parts of the country funny videos, jokes. I really welcome these at this time. It is great to find ways to laugh, and I urge you to work at that. I want to make some remarks about this particular pandemic that we're facing. First of all, I feel that the U.S. as a nation was colossally and really unforgivably unprepared for this. Infectious disease experts had been warning us for years about the coming pandemic. This had made its way into popular films like Outbreak and Contagion, into many books. So everyone knew that this was coming. Infectious disease experts have also talked a lot about the next one. I don't know that this is the next big one. I think that's still to come, and that would be a pandemic, probably viral, with a much higher mortality and infectivity. And I think it's certain that one of these is going to come again. In addition to this long period in which we've been told that this would happen, we had months of seeing what was developing in China to get ready for this. And it is just inexcusable that we were unprepared to do testing on a wide scale or to initiate social distancing early enough to really make a great difference. So I hope this can be a wake-up call to people and practice for something that could be much more serious in the future. I think we really have to get our ducks in a row to be prepared for this kind of thing. The other thing I want to stress is that pandemics of this sort are becoming more frequent and more serious. And these are particularly epidemics of zoonotic diseases that jump from animals to people. They are becoming more frequent, more serious. These are things like SARS and MERS. AIDS is probably the most serious one that we faced. And without treatment, that was 100% fatal. Why are we seeing these diseases become more frequent and more serious? I'm afraid the reasons for this are very clear, and they're all human caused. It has to do with the fact that there are too many of us. It's overpopulation is a root cause. We're living in too dense concentrations in cities. That's a real modern trend of people leaving rural areas and concentrating in cities. We have had immense and destructive impact on the environment and habitat. We have removed forests. Our practices of farming and raising animals favor the transmission favor this kind of spillover of diseases from animal reservoirs into people. Climate change has favored all of this. And I think we have to, really have to sit down and consider what of this we can change. Is there anything that we can change to make people aware of the human-driven factors that are putting us at greater and greater risk? So as I say, I hope this will be a wake-up call to all of us. And I think that's another area in which integrative medicine can be very valuable by educating people about the relationship between human behavior and our susceptibility to these kinds of epidemics.
Thank you, Dr. Weil, for that important introduction. I think you're warning us of something that as a society, as you said, we have not paid enough attention to. So we will hear more from Dr. Weil during the Q&A. And now I want to turn it over to our medical director, Dr. Randy Horwitz, who is really going to help us understand some of the immunology and virology to help us better understand how the steps we take, both with pharmaceuticals and also with dietary supplements and with lifestyle, can help us stay healthy. Randy.
Thank you, Victoria. And one little apology. I'm a little congested, a little hoarse. It's one of the few times in life you wake up all congested and blowing and you say, thank God it's allergies. So, okay. So therapeutic considerations. My purpose is to lay the foundation for our recommendations, and this requires a bit of an overview regarding the disease process, but first, a little background about the virus. And I apologize to any healthcare professionals online. This is going to be simplified so we are all on the same level. Yeah, did you ever feel like every graph we see looks like this? It's getting old fast, but I won't show any of those. Okay, here is our formidable enemy, and unfortunately in this picture, you'll see this on the internet, it looks warm and cuddly. It's not. Peter Medawar, who was the father of transplantation immunology, said a virus is simply a piece of bad news wrapped up in protein, and that's true. The red are the spike proteins. This is how the virus attaches to our cells initially and attacks. You can see it looks kind of like a spaceship, and if you think of that as the correct analogy, it'll be helpful. Inside, coiled up like a snake, that's the RNA. That is the blueprint for how to make more of these spaceships. So it does sound like a really grade B science fiction movie, but the truth is even harsher than that. So let's take a look a little closer at the virus with this schematic. There are all the points that I brought up in the last slide, the spike protein and the shell, if you will, and inside is the RNA, the genetic blueprint for how to make more. First of all, it's a large virus, at least as viruses go, but I don't mean to confuse you. So right now, pluck a hair from your head and put it between your fingers. If you're like me, you can just tip your head over and a bunch fall out, and Dr. Weil can yank one from his beard, but take that hair and look on it, look end on end so you can look at the diameter. So if we look at the diameter of that human hair, how many viruses can you fit across that? You can fit about 700 to 1,000 virus particles. 700 to 1,000 across the diameter of a human hair. That's how small this virus is. But as far as viruses go, it's a little larger. It is moderately to highly infectious. That is, it's transferred with relative ease. Not as bad as measles, which is highly infectious, but it's certainly worse than influenza at this point. It is moderately virulent, and virulence is a measure of how severe, how fatal, how bad the disease is that it causes. And at this point, it's moderate, certainly worse in certain populations. Next, the goal of the virus. Let's reverse our thinking a little and think about it from the virus standpoint. This virus wants to take over the world, nothing short of that. It wants to take over the whole world, and the way to do it is not to infect someone and kill them right away, no. The purpose, or the best way to accomplish this is for the virus to infect someone. They walk around for weeks without symptoms, spreading it left and right, spreading virus to all these people, and then taking the time to multiply within a host. And perhaps at the end, billions and billions of virus particles are released. But it's in the virus's best interest to spread. Luckily, this virus, like every bad science fiction war of the world's movie, has an Achilles heel. That's that envelope, the shell I talked about. It's made up of fats and proteins. And if you're a cook, you know that when you fry something in a pan, take it to the sink, fill it with water, and put a drop of detergent in, everyone likes to see all the fats dissolve. That's exactly what happens with a virus. That's why we say wash your hands with soap and water. It will dissolve that virus envelope, and the virus will be destroyed. Okay, vaccines and antivirals, yes, that we're working on them, nothing solid yet. So there are two different sets of recommendations that are going to be made, and this goes for not just our program, but anywhere you read. One is pre-infection prophylaxis. You're not infected yet, you want a robust immune system, you want to fight off this virus, nip it in the bud or prevent it from coming in, and we'll talk about that for 1 minute. Then if you get infected, the big issue here is pulmonary disease and its complications. This is what is doing people in, cardiovascular and pulmonary disease. I'm going to talk about two clinical entities, ARDS, acute respiratory disease syndrome, and this is a destructive process that occurs in the lungs from this virus. The second is what we call cytokine storm in immunology. The real term for it is secondary hemophagocytic lymphohistiocytosis. So now you know why we pick cytokine storm. Cytokine storm, we'll talk about that. It's when your own immune system tries to fight this virus, goes into overdrive, and doesn't stop. So our recommendations will be based on what we're trying to do in this particular cycle and where an individual happens to be. Okay, prophylaxis, how to prevent the virus. Lock yourself in a room, don't see anyone, don't talk to anyone, get in isolation, not feasible. But we can have physical distancing as they're doing in this grocery store. In addition, you can maintain a healthy immune system. Simple interventions, getting a good night's sleep. We know there have been studies of people who are sleep deprived and then infected with influenza as part of a study versus people who had plenty of sleep. People who are sleep deprived do worse in general with severity, with longevity of the viral infection and symptoms. We know that good nutrition, as Andy mentioned, is really important. Dr. Sternberg will talk about stress as it impacts the immune system, very well described. And finally, Dr. Alschuler, after I'm done, will talk about select supplements that may help with this. Okay, viral infection. Busy slide, but we can talk about the words. I put up the pictures if you're a visual learner. Here's what the virus does. So the virus gets into your body. It binds. So maybe you shake hands with someone, you touch your nose, touch your mouth, binds to a cellular receptor once it's in, the ACE2 receptor we can talk about later if you want. So it binds with this spike protein, that red spike protein, binds to the cell, and then it takes over. It sneaks inside. First, it shoots in that blueprint, that snake-like blueprint, its RNA. And then the cell, which has an assembly line, the cell is constantly making proteins and blueprints for itself. But this virus hijacks the cell's factory. So now it's using all the factory workers and just changing the instructions using its RNA and saying, hey, guys, now you're going to start making virus shells and virus proteins and more spike proteins. In addition, at the end, it's going to create the shell, new shells, and pop in an extra instruction sheet with each one. That's the RNA. So out of an infection, you can get tens of thousands of new virus particles made that are released to the system. So if you want to look at the pictures, it's there. The red writing on the left-hand side, this is from Science Magazine, are sites of intervention. These are drugs that we're testing that would operate at different stages of the viral infection that may interfere, may not. So again, a busy diagram. It's hard to find simple medical diagrams, but let's talk about the words first. ARDS and cytokine storm. So shake hands, you rub your nose, the virus infects cells of the upper respiratory system. That's everything from the neck up, your nose, your throat. There's a bunch of cells there that normally help you fight disease, cells with cilia or little hairs that move particles away. You have cells called goblet cells that make mucus that help trap foreign invaders. Anyway, the virus can infect these cells. And what do? They release a lot of new virus and they destroy the cells, your ciliated and goblet cells. You start coughing. You may get a fever from the immune reaction going on in your upper respiratory system. Now, if you're lucky, if you're young, if you have the right genes, the whole thing could end there. You have a strong immune response, you're fine. However, for the rest of us, this may go down to the lower respiratory system. And for that, that's below the neck, it's your lungs. And for a second, I'll simplify lung physiology. Imagine your lungs as two big sponges. The air holes in the sponges, we call these alveoli. And air, when you take a deep breath in, goes into these air pockets, and then the structural part of the sponge contains blood vessels. So blood is constantly coursing through your lungs. You take a deep breath in, oxygen, good air, comes in and is exchanged into your blood vessel, taken to all your organs. The bad part of air, carbon dioxide, is exchanged, goes into your lungs, you breathe out, in with the good, out with the bad. Pretty simple. Now, the virus, however, infects lung cells, and these alveoli, these air sacs, they have cells that make a coating to make sure they open nice and wide, kind of a lubricant called surfactant. A lot of cells in the lungs produce this, and that keeps our lungs open. Well, the virus infects lung cells, including these type 2 pneumocytes that are making surfactant or lubricant for the lungs. So your lung cells start dying. They start making more virus when they die, releasing more virus, and the immune system starts fighting it. What also happens from some of these immune markers or immune proteins is that other effects occur. For one, the plasma, the serum, the fluid that's in your bloodstream can be released into your lung. And now you have fluid accumulating in your alveoli. So the immune system starts operating. It says we have a big infection here. It starts sending for reinforcements that are getting into the alveoli along with plasma that's carrying these cells. And if you look in the diagram, on the left is a healthy alveoli. On the right is one that's filled with fluid. So now there's no gas exchange. You can't breathe through liquid. We're not fish. So we can't get that gas exchange that occurs, that normally occurs when your alveoli or air sacs are filled with fluid. So in the immune, and there we have the fluid filling the alveoli in the diagram. Macrophages are cells that are all around the body. Macro, big, phage, eat. They're big eaters. They grab the virus and they say, wow, something big is going on here. We need help. Cells can't yell. They don't have mouths, but they can send out signals called cytokines. They release proteins that are help signals. And they say, we have bad stuff going on in the lungs. We need lots of cells to fight this. These cytokines have all kinds of activity. They promote the fluid accumulating. They bring in other cells, other immune cells. Platelets come in. You can get blood clots forming in the lung. It's like a big war, a cytokine storm, if you will, in the lung. Fibroblasts come in. Fibroblasts are normally great cells. They repair damage. This is great. We have repair cells coming in. However, in the lung, this isn't great. Fibroblasts lay down scar tissue, which is great in some tissue, but the lung has to be pliable, has to expand. Fibroblasts induce what's called fibrosis or stiff lungs, making it really hard to intubate or aerate a patient. When a patient gets to this stage, when there's fluid in the lung with ARDS, with or without cytokine storm, they usually have to be intubated or have a ventilator which provides external oxygenation. In addition, the decreased blood supply or oxygen supply in the blood will decrease blood supply to vital organs like the kidneys that may shut down. In other infections, the mortality from ARDS can be as high as 50%. With the cytokine storm, it can be even higher. And there is no specific drug therapy for this right now, which is a big concern. Okay, I'm going to make you all radiologists with the last couple minutes. A CT scan is nothing more than taking a person, lying them on their back, and radiologically cutting a slice out of them and holding it up to light. So this patient on the left, normal, healthy patient lying on their back, we take a little slice right through their mid-thorax, through their chest. We can see the right and left lung. There's the heart. You can see their spine. That big white bone is radiographically opaque. That's the spinal vertebral canal. You can see a little lung nodule. Maybe they had cocci. But otherwise, look at how clear the lungs look. Those are beautiful, clear lungs. Now look to the right. Here is an early sign of a patient with COVID-19. The virus is called SARS-CoV-2, but the disease is coronavirus disease from 2019, COVID-19. So here's a patient with COVID-19 disease. What we see are, it's not clear, it's not black anymore. We see infiltration. And if you're a doctor, you look at that and say, boy, kind of looks like ground up glass, doesn't it? And that's exactly what it's called, ground glass infiltrates. Let's look at a patient's progression with this condition. Okay, on the top, we're looking at CT scans 5 days after a patient who developed a fever and chills. 5 days later, look at those lungs. Look at that middle panel in the top row. How much oxygen can you get in through lungs that look like that are normally supposed to be clear? Those lungs are opacified. That is ARDS, with or without cytokine storm. The virus is dividing in there, cells are called in, and there's not enough room. There's fluid in there. There's not enough room for oxygen to diffuse through to the rest of the body. On the bottom is the same patient 19 days after symptom onset. That patient was still intubated, and however, the lung disease is clearing up. So the next slide, which is my last slide, leads into Dr. Alschuler's. Here's the issue when we're talking about therapeutics. We have to try to prevent infection. You need a robust immune system for that. We need to try to stop the virus from replicating, dividing, or spreading in the body. Again, you need a robust immune system to deal with that. However, what happens once it hits the lungs? Cytokine storm. We don't want a robust immune system then. We need to pull back the reins and say, whoa, you're causing bystander damage to our cells. We don't want a robust immune system there. But can we shut down the immune system? Oh yeah, there's a lot of drugs that'll do that. What happens when we call off those overactive cells? What happens is the virus goes nuts with nothing to stop it. The virus keeps dividing. So it's that fine balance we're trying to achieve, and they're doing it by targeting specific cytokines. Prednisone will knock out all the immune system. The virus can go haywire. You won't have cytokine storm, but you will have ARDS from the virus. So specific cytokines may be helpful. And finally, how do we hasten recovery from this in someone like the bottom panel where the lung disease is clearing up? And so to take this conceptually through, that will lead into our next talk. Thank you.
Thank you so much, Randy. It's an incredibly complex topic, the immunology, the underlying physiology of the pulmonary system, the lungs, and thanks so much for helping everybody to have a clear understanding of that. We'll now have Dr. Lise Alschuler talk about what is the potential role for using dietary supplements, both to reduce the risk of getting COVID-19 to begin with, and if you do have it, what should you do, what should you not do? Lise.
Okay, so I'm going to give a highlight of some concepts and some examples of the concepts. And of course, there are thousands of dietary supplements. We're not going to be able to address all of them. I do want to make a very important caveat to this, which is that there are no human clinical trials that have been done on any integrative therapy or dietary supplement to date. There are some in progress in China primarily, but nothing has been completed yet. So these are all what I would categorize as theoretical recommendations, things which have preclinical evidence. There's some cell studies that have been done, perhaps some rodent studies that have been done that give us an indication that they might be helpful for humans, but we don't know that definitively at this point. And so when we have that kind of evidence base, it's very important to apply a logic to how we think about what we might want to use, and that is to evaluate the potential benefit against the potential risk of any particular supplement in this case. And so if you look at this table, you can see it's basically pairing the likelihood of benefit and the likelihood of risk. And anything on the bottom is what I would call fair game. Of course, the best possibility is something that has a high likelihood of benefit given the evidence that we have to date, and a very low possibility of risk. Those are, in my opinion, things that I'm confident in recommending or using. Even if something is maybe less secure in terms of our belief in its benefit, but it really has no potential risk, those are also okay. But anything that has high possible risk, and in the case of COVID-19, just as Dr. Horwitz mentioned, what we're really thinking about is anything that could potentiate the cytokine storm or aggravate the respiratory distress. Those, even if they might be beneficial in other situations, would not be indicated in this situation. So this is, again, a little bit of a complicated graph, but I just wanted to context the recommendations talk about this in stages, if you will, or phases. So if you look at this graph, that first arrow is looking at the ACE2 receptor, which we now know is how this virus gets into cells. So there are some natural supplements which can interfere with viral entry or viral docking. The next thing we want to think about is inhibiting viral replication inside the cell. And viruses they actually make, as part of their RNA, these proteins called proteases, and these proteases are necessary for the virus to replicate. And again, there are some natural supplements which inhibit proteases, so that becomes theoretically a part of our antiviral plan. And then the third component is to increase what we refer to as innate immunity, or sometimes we also talk about these cells as our antigen presenting cells. These are really the sentries of our immune army. These are the cells that meet the invaders, and the more active they are, the better chance we have at nixing the infection right at the get-go. And so anything that we can do to increase our innate immunity also has potential value. So that's kind of the three components from a prevention standpoint. So let's go to the next slide. So let's talk about each of these and give some examples of how we can do this. So in terms of blocking viral entry, again, we're thinking about this ACE2 receptor. There are some natural compounds which have been shown, again, not in humans yet, but in preclinical studies, to block the ability of that viral receptor combination, or to downregulate these receptors. So for example, astragalus, which is an herb that's been used historically in traditional Chinese medicine for upper respiratory tract infections, has been shown to decrease the activity of the ACE2 receptor. Another very important compound, in my opinion, is quercetin. Quercetin is an example of what's called a flavonoid, and I'll come back to those in a moment. Flavonoids are ubiquitous throughout plants, and quercetin is a very important flavonoid for us, and you'll see this come up again, but one of the things that quercetin does is it binds to that ACE2 receptor, so it sort of takes up the spot, so the virus can't get to it and can't activate or get into the cell. So quercetin is considered to have some blocking activity. And then the final thing I'll mention in this regard, and again, these are just examples, there are more compounds, but vitamin D also reduces ACE2 activation. So one of the things you'll see in these three examples is that there are at least three different ways that we can downregulate this virus ACE2 receptor binding activity. And these are examples of three different things that address all of those aspects, so one could surmise that this might be a good trio to try to prevent viral entry. So another one I want to mention, which I think has gotten a lot of attention, if you will, as I'm sort of watching what people are discussing, is elderberry, or Sambucus nigra. This is a beautiful plant. It's been used for a long time for upper respiratory tract infections, not so much to prevent them necessarily, but to reduce the time of the infection and to lessen the symptoms. And there's been some pretty good clinical studies using elderberry in other types of viral infections that cause influenza. What's interesting in the case of the coronavirus is that there's another human coronavirus, not the SARS-CoV-2, but something called NL63. And that particular virus, when elderberry is applied to cells, can't get into the receptors and can't get into the cells. So there's a potential that elderberry may also act to prevent viral entry in the case of SARS-CoV-2. Now I'm moving on to the second phase of prevention, which is to reduce viral replication. So the main way that our cells reduce viral replication is through zinc. Zinc is our body's most important, what we call endogenous antiviral replicating agent, if you will. It's a very potent inhibitor of the proteases that this particular virus uses to replicate itself. So zinc, I think, has a lot of potential as a preventive agent in the case of SARS-CoV-2. Again, it hasn't been clinically studied yet. I hope that it will be at some point. So zinc itself is important, and obviously that's available as a dietary supplement. You can also eat zinc if you eat nuts and greens and some of the other kind of dark green vegetables. There are also some compounds that are what are called zinc ionophores. These are compounds that bind to zinc and bring zinc into the cell. And here we see quercetin again, and its cousin dihydroquercetin. Again, these are flavonoids. You can find quercetin in onions and apples especially, and it too is available as a supplement. And quercetin will bind to zinc and bring it into the cell. The same thing is true for epigallocatechin gallate, or EGCG, which is an important component of green tea especially. So these become important as what I would consider cofactors to help zinc get into the cell and do its antiviral replicating activity. So the third aspect of prevention is to improve that innate immunity, those initial immune cells which prevent the virus from getting into the cells or interacting with our cells to any large degree. And this is where vitamin D, I think, is really important. We know that vitamin D activates innate immune cells, so things like macrophages and dendritic cells. It also increases their secretion of something called cathelicidin, which is an antiviral peptide. So it not only activates these cells generally, but it specifically activates their antiviral fighting capabilities. And it does this not only throughout the body, but very specifically in the respiratory epithelial cells that Randy was mentioning earlier. So I think vitamin D has a very important role to play. Now, having said that, more is not better. When we have too much vitamin D, it has an immunomodulating effect. So it can bring some things up, but it can also bring some other things down. And one of the things that can happen if we have too much vitamin D is that we accentuate what we call Th2 immunity, and that actually can underlie an inflammatory response and can actually contribute to the respiratory distress that we were talking about earlier. So vitamin D should be sufficient, but should not be in excess. Now, the best way to determine this is to have your vitamin D level checked, and then if you're low, to supplement to get sufficient. There's controversy about what exactly sufficient vitamin D is technically. Using most lab values, it's between 20 and 30 to become sufficient nanograms per deciliter, but we'll leave that aside. We certainly can answer questions about that. Okay, so now I want to shift over, and this is a really important and kind of unique and a little bit confusing aspect to the coronavirus. As was discussed earlier, we want to balance our ability to stage an initial defense to prevent the virus from infecting our cells, but at the same time, very high up on our priority list is to reduce the chance of that virus creating this over-inflammatory response. And this has to do with something called NLRP3 inflammasome. So I know this picture is a little bit busy, but let me just take you through it for a moment. When a virus is brought into a cell, it triggers the reaction in the cell to upregulate something called NF-kappa B, and I'll come back to that in a moment. NF-kappa B in many ways is considered the master switch of inflammation. So when NF-kappa B is activated, a lot of other inflammatory proteins are made by the cell. So the virus activates this NF-kappa B, which starts to make these inflammatory compounds, which are called cytokines and interleukins. And at the same time, if there's other metabolic stresses in the cell, those collaborate to activate what's called the NLRP3 inflammasome. And this inflammasome is basically, you can kind of think of it as a collection of molecules that will very clearly and in a very fast-forward way perpetuate inflammation. And we know that the SARS-CoV-2 virus activates the NLRP3 inflammasome, which we also know underlies both the cytokine storm and in many ways the respiratory distress that can be associated with this virus. So from a prevention standpoint, if we acquire the virus or we're in the early stages of infection, it's very important at that point to keep our, as Randy said, to keep our viral defenses up, but at the same time we want to shift our focus to reducing a hyperinflammatory response and specifically try to downregulate this NLPR3. So with that being said, one would have, what we might be asking the question, well, does this, even work, and does it make sense? And there's been some good rodent studies that have shown that when the NLRP3 inflammasome is downregulated, that the lung injuries associated with various viruses actually don't occur to the same degree, and yet the viral clearance is still maintained. So there are ways to reduce this inflammation and still maintain our antiviral immunity, and that's the goal. So how do we do that with supplements? There are a few I'd like to mention, and again, these have been studied specifically to this particular inflammasome. So the first is vitamin C. Vitamin C reduces NLRP3 inflammasome activation. Although not studied in this particular infection, it has been studied in humans in a variety of other viral infections and has been shown to shorten the frequency of the infections, the duration of the infection, and the severity, and very importantly, reduces the incidence of a virus as an upper respiratory tract infection becoming pneumonia, which is somewhat analogous to the respiratory distress that we see in COVID-19. So vitamin C, I think, has a very important potential role. The other one I want to mention is melatonin. Melatonin is a hormone that we secrete naturally when we sleep. It is also available as a supplement, and this specifically inhibits NF-kappa B, which I mentioned earlier is that key master switch of inflammation that the virus turns on, and it also inhibits NLRP3 inflammasome activation. What's important about melatonin is that it's very active in the lungs, and it specifically reduces damage to lung tissues and inflammation in the lungs during viral infections. So I think that also has a potentially very valuable role to play. Other things that we can think about to reduce NLRP3 inflammasome activation fall into this category of plant flavonoids. So flavonoids are pigmented compounds found in plants. That's why plants have so much color to them. That's because of the flavonoids. There have been at least 4,000 flavonoids that we've identified in edible plants. This is really important because flavonoids, we only get them through plants or supplements, and they specifically reduce both NF-kappa B and NLRP3 inflammasome signaling. And this is one of the reasons why it's so critical to have a plant-forward diet. We have to eat as many of these flavonoids on a daily basis as possible. And just keep in mind that the recommended servings for vegetables is about 7 to 10 servings, a serving being a cup of raw or a half a cup of cooked, so lots of vegetables. In addition, from a supplement perspective, certain of these flavonoids have been extracted and are available as a supplement, and I think that there are potential roles for these supplements in the situation of COVID-19. Again, quercetin comes up. So quercetin we can eat through onions and apples, or we can supplement. Quercetin, in addition to the antiviral actions that I mentioned earlier, and its ability to improve innate immunity, that first defense against viral infections, it specifically inhibits some of the key cytokines that this inflammasome upregulates. So it has a very clear and distinctive and potent anti-inflammatory effect. Garlic has many compounds, flavonoids, as well as these compounds which are sulfur compounds, which gives garlic its odor that we all enjoy. And these organosulfur compounds in garlic activate innate immunity and also suppress these inflammatory cytokines that are involved in this NLRP3 inflammasome. And finally, we come back to epigallocatechin gallate, or EGCG, from green tea, which again blocks viral attachment that I mentioned earlier, but it too downregulates these pro-inflammatory cytokines, specifically something called IL-1B, which if you read any of the literature on this inflammasome, you'll recognize as the key cytokine that tends to drive this inflammation from this particular viral infection. Another very important flavonoid to consider in this regard is curcumin, which we find in turmeric root. So we can certainly eat turmeric powder. You really can't eat enough turmeric powder. We can also take curcumin as a supplement, which comes from turmeric. This has antiviral activity. It reduces the attachment of the virus, the entry of the virus. It downregulates those proteases, so it inhibits viral replication. But most importantly, curcumin is really known as a key anti-inflammatory flavonoid. It's a very, very potent downregulator of NF-kappa B, and it downregulates all of the key cytokines that are involved in the cytokine storm of COVID-19, IL-1B, IL-8, tumor necrosis factor alpha, IL-6, and has been shown in other viral infections to reduce cytokine storm. So we have some evidence from other viruses that curcumin may have a very critical role in decreasing the potential for having a cytokine storm as a result of this infection. Curcumin specifically inhibits this NLRP3 inflammasome. So that's exactly what we want. How can we downregulate this inflammasome and maintain the antiviral actions at the same time? And curcumin is a good example of that. And then I just want to mention mushrooms, mycelium, so when we think of mushrooms, we think of the fruiting body, which is what we see above the ground. Underneath that fruiting body is a filamentous network, and these really thin filaments are called the mycelium. And many of the mushroom supplements that we purchase are a combination of the fruiting body and the mycelium. And any extract of fruiting body mycelium have the ability to not only activate that innate immunity, so we increase our initial defense against the virus, but they also regulate the immune system, and they actually upregulate something called IL-1RA, which is an interesting compound because it directly inhibits the IL-1. So IL-1, remember, is that key inflammatory cytokine that this NLRP3 inflammasome makes and drives this inflammatory response. So if you can upregulate its antagonist, then you can sort of push back that inflammatory reaction. And that's what mushrooms tend to do. And many, many, many mushrooms have this effect. So this is another thing to consider. So again, I've just touched on, there's obviously lots of things that we could consider. I'm sure there's questions about other supplements, but I just want to again emphasize that there are no clinical trials which tell us that all of what I just talked about actually makes a clinical difference in humans. So we're just using the best data we have to date. And again, just apply this algorithm, if you will, of looking at what's the potential benefit versus what's the potential harm. So what I've presented to you today are things that I consider to be of potentially high benefit and really low to no risk. And these are not in any way a substitute for our public health measures. And of course, if you have symptoms, we're not suggesting that you try to treat this on your own. You should seek medical care. And if you've never used dietary supplements, I think it's helpful to consult with an integrative practitioner, many of whom are doing telemedicine right now. So I would certainly recommend that. Thank you.
Thank you so much, Lise, for that. Really, it's such a big and complex topic to think about the various dietary supplements and how they function in the body and what is useful and what could potentially be dangerous. I do want listeners to know that on our COVID-19 page, there is information about dosing, and there's references that you can look at if you want to have more of the science behind this. There's also a frequently asked questions page where some of your questions, for example, about vitamin D, how much, what to do if you don't know your level, it gives some suggestions to help guide you there. So next I have the pleasure of introducing our research director. Really, Dr. Sternberg is internationally known as one of the people who did pioneering work on the connection between the mind, the body, the brain, and the immune system. And she's going to be speaking to us about the impact of stress and also how we can make our home a sheltering place. Esther.
Thank you so much, Victoria. So I am going to be speaking about managing stress and making your home a healing place, as Victoria said, in this time of the COVID-19 pandemic. And sheltering in place, I like, Victoria, your comment, we could think about sheltering as a positive thing. And that's what I hope to leave you with at the end of this talk. How do you turn the bad stress into good stress? So why manage stress? Dr. Weil mentioned the fact that the stress response is very important in affecting your immune system. Besides managing stress because we don't want to feel stressed, we know that chronic stress is associated with more severe and more frequent illness. So more severe and more frequent viral infections, reduced vaccine take rate, prolonged wound healing, speeding of chromosomal aging, and speeding of cancer growth. And it's important to remember that stress does not cause these conditions. stress, because of the stress hormones like cortisol, adrenaline-like nerve chemicals, they all impact your immune system at every level. They impair your immune system's ability to do its job, to fight infection and to heal. What can we do, though, in a situation like this where billions of people around the world are stressed? You're stressed because of the fear of the virus. We're stressed because suddenly we've lost all of those positive interactions, like social interactions, gathering together, going to work. Who would think we'd be missing going on a crowded subway or a bus and going to the gym? We're not able to do all of these things in addition to being made to stay home in order to prevent the spread of the virus. And then we have the additional stresses of homeschooling and so on. So we're exposed to so many stresses now that we weren't exposed to before. So you can do something about it. It's scary, but you can do something about it. A fighter pilot once told me, when I asked him whether he felt stressed when he was landing his little jet plane on a aircraft carrier in the middle of the night in the middle of a storm. And he said, yeah, we feel all those things. We feel our heart beating fast. We feel anxious. We feel like running to the bathroom. We feel sweaty. But we've been trained to make our stress response work for us. And that's really important. And you can do that too. So the reason that we can do that is because the stress response is a very funny thing. The brain's stress response is essential for life. Those nerve chemicals and hormones that are released when you're exposed to a stressor give you the strength to fight or flee, give you the focused attention and the energy to accomplish the task at hand. On this slide, you can see that your stress response, which is on the horizontal arrow, as the stress response gets higher, your performance improves to a point. So if your stress response is too high, that's when performance fails. It's kind of like if you get a little bit of email, it's fine. If you get a lot of email or a lot of spam, what do? You have to shut down and reboot. And that's what we need to learn how to do. We don't want to get rid of stress. We want to make it work for us. So how do we do that? Well, there are a number of ways, and these are the integrative approaches to stress reduction. My way that works for me and the pilot who I mentioned, and for people and first responders, is take control. Now, how do you take control in a situation where the whole world seems to be out of control? Well, you can't take complete control. You can't get rid of the virus necessarily. You can't stop sheltering at home. But you can think about what it is that you do best. What is your expertise? We all have some area of expertise that we can focus on. Are you a good, do you sew? You can sew masks. Do you teach yoga? You can teach yoga online. Do you teach ballet? You can teach ballet online. Whatever it is that you do well, think about it and think about how you can turn this expertise in a way to help others virtually. And we're so fortunate now that we have the ability to interact virtually as we are now. And we can gather socially, virtually, without having to expose others or ourselves to the virus. This is the week of Passover and Easter for many people in the world. And I know that in my family, we're joining several Zoom Seders, Passover Seders. Many churches and synagogues are having special services online. Gather virtually, because social interaction, social connection has been shown to not only reduce those negative stress hormones and reduce stress, but it also enhances the positive, the reward pathways in the brain, the dopamine reward pathways, the anti-pain opioid pathways in the brain are enhanced by social gathering virtually as well. Get a good night's sleep. Dr. Weil mentioned getting a good night's sleep, and I'll talk about that in a few slides. How can you help to get a good night's sleep? Move, exercise is so important. You can take exercise classes online. You can walk around your house. You can, if you're in a location where you can socially distance or physically distance from people, you can walk outside, walk in nature. Nature and views of nature are universally soothing and reduce stress. I had a wonderful experience here where someone sent me a plant that I have sitting in front of my desk, so I can look out at the plant, and I can look out the window at the beautiful trees, and here in Tucson, the desert in flower in spring. There are mind-body approaches. Dr. Weil mentioned 4-7-8 breathing. You can go online and to our COVID-19 page, and you can see Dr. Weil's demonstration of this. There's meditation, Tai Chi, yoga, guided imagery. And again, on our COVID-19 page, you'll see more of that. There's massage. Healthy diet is so essential, as you've heard from every single one of the speakers. And then spiritual activity. Spiritual activities are very important for reducing stress. All of these interventions, all of these activities that you can engage in do the same thing, including the breathing. They reduce the stress response, reduce those stress hormones that are impair your body's ability to fight infection, and they enhance the positive. They enhance those positive dopamine reward pathways and enhance those positive anti-pain, feel-good endorphin pathways in the brain. So this is my Wellness Coach app that Dr. Maizes mentioned at the beginning of the presentations. You can go online and download it, and it summarizes the 7 domains of integrative health and stress reduction and goes into more detail of what I just described in the previous slide. So I'm not going to talk about it except for the one, next slide, the environment. How do you make your home a healing place in this time of sheltering in place? Well, we know that there are many elements of the physical environment that can stress, and there are many that can calm. Too much noise, too much light, bright light, temperature and humidity that are outside the comfort zone, crowding, odors, mazes, and the elements of the built environment that can calm include calming nature sounds, calming music, light, circadian light, sunlight in the morning, temperature and humidity in the positive comfort range. As I mentioned, views of nature and being in nature. Fragrances like lavender, so aromatherapy is important to help reduce stress. And labyrinth is a pattern on the floor which allows you to get into a walking meditation. The monks used to do this in the 14th century, and labyrinths are found all over the world. There is evidence. There is evidence for the benefits, potential benefits and potential downsides of various aspects of the built environment on health and well-being. And I've been working with the U.S. General Services Administration that builds and operates all non-military federal buildings in the United States and around the world. And we've been using wearable devices to measure various aspects of health and well-being in relation to the different elements of the built environment to which people are exposed. So I'll show you a little bit of that data. What we've found in our studies with the GSA is that increased activity, and these are mostly in office buildings, which we're not in now, but it applies to homes, it applies to wherever you are. Increased physical activity during the day is associated with decreased stress at night, stress measured using wearable devices, and improved sleep quality, again, objectively measured using wearable devices. So anything you can do to increase your movement during the day can help reduce your stress and improve your sleep quality. It's important to not overdo it, because if you overdo it, you're going to enhance those negative stress hormones. So if you're not used to training, don't start now to try to be an Olympic athlete. Do gentle walking. That's good enough. Half an hour of gentle walking during the day is good enough. Circadian light. Circadian light is sunlight, bright sunlight in the morning from 8 a.m. to 12 noon, and dimmer light in the evening. And this goes also to your computers, because your screens tend to have blue light, which is similar to that circadian light. So you don't want to be exposed to too much blue light in the evening. And there is a setting on the computer which can shift your screen to more of a reddish tint in the evening. So there is evidence, and I'll show you that in a moment, mostly from Rensselaer Polytechnic Institute, who works with the GSA as well, showing that this circadian light, bright light in the morning, is associated with better sleep and better moods. Sound. We've found that sound within about 40 to 50 decibels, not more, not less, is associated with the least stress. Carbon dioxide. Carbon dioxide is the gas that you exhale, you breathe out. And I'll show you data showing that when there are too many people for too long in a small space where the ventilation is not good, that is not optimal for health. So we found that up to 550 parts per million in the air is optimal. Relative humidity between 30 and 60% is optimal for stress and for health, and probably closer to 40% plus or minus 5%. So this is data from the Rensselaer Polytechnic, Mariana Figuero, that shows that morning light is associated with falling asleep faster, a lower depression score, and better sleep quality, because impaired sleep is associated with poor moods. You may notice yourself that towards the end of the day, you're tired, your mood is worse. So it's important to remind yourself, oh, it may just be that I'm tired, let me go to sleep. And of course, as Andrew Weil mentioned, good sleep is important to helps your body prevent infection. This is the data for showing the impact of carbon dioxide in the room. So when the carbon dioxide that you're breathing out, that everybody is breathing out, and I want to make sure that everybody knows this is different from carbon monoxide. Carbon monoxide is very bad under any circumstance. And that comes from poor furnaces and stoves and whatnot that are burning gas. Carbon dioxide is the gas that is the air that you breathe out of your lungs. And at 550 parts per million, you're at 100% cognitive performance. At 900 parts per million, your cognitive performance, your ability to think, goes down to about 85%. And at 1400 parts per million, it goes down to about 50%. And at that point, you're fatigued, you're falling to sleep, you're not thinking clearly. So what can you do about that? Get up and walk around, open a window, open a door. If you are in an apartment where you can't open a door or window, you go out and walk around outside as long as you can be physically distanced from people. Or you can put a fan next to your computer to blow away that carbon dioxide if you've been sitting there for a long time. So this is the findings that we found looking at relative humidity. So it's not the heat, it's the humidity that counts. We did not find an association of temperature with the stress response, but we did find an association of humidity. We found that between 30 to 50% to 60% relative humidity is optimal, and that greater than that or less than that, the stress response was 25% higher. And this shows the 45 plus or minus 5% optimal for maintaining the stress response at a reasonable level. Now, why is relative humidity particularly important? It's been shown in other studies, this is another study not performed by our group, that when the relative humidity is too dry, less than 30%, hospital infections increase. And the thinking is that the reason for this is that your mucous membranes dry out, and you're more likely, therefore, to get viral infections. particularly important in this time of coronavirus. Too wet is not good. There's a risk of mold. So you want to be sure that your relative humidity is in a reasonable comfort range. If you can't measure it, if your HVAC system doesn't allow you to put the right the humidity in there, you can put a humidifier in your room when you go to sleep at night. So, and this is my last slide. So there are many ways that you can make your home a healing place. And the easiest way to think about this is think about what you see and hear and smell and touch and do in a place and eat and taste in this place. So there's many ways that I've mentioned for stress reduction, changing the environment so that the environment is less stressful. Views to nature are so important. Being in nature is very positive across cultures, across ages, all genders, socioeconomic groups, and so on. It's been shown that this love of nature reduces stress. Find spaces for movement. Find spaces, virtual spaces for social gathering, spaces for meditation and gardens. Healthy eating is so important, as you've heard. And you can make this a social activity, whether you do it with your kids who are at home, whether you do it virtually with friends. You can cook up great meals together and then eat healthy and help your body to prevent infection and to heal as well as it possibly can. And then finally, sleep, as I mentioned, circadian light, reducing stress, gentle exercise, and aromatherapy like lavender all help improve sleep and improve moods. So with all of these things, you can make your home a healing place, and you can take control and turn your bad stress into good stress that gives you the energy to fight this situation and come out healed. And with that, I'll take questions. Thank you.
Thank you, Esther. So we're now going to have, sadly, not a long Q&A, because all of our speakers, except for Dr. Weil, went long, but a short Q&A. And Dr. Anne-Marie Chiasson, who's our fellowship director and associate professor of clinical medicine, is going to join me in bringing forward the questions that are on the chat and on the Q&A. I am going to ask panelists, please answer as briefly as you can so that we can cover many questions. There are hundreds of questions, and a lot of them have actually been addressed already on our FAQ, our frequently asked questions site on our website. So we'll try to avoid those and move into questions that haven't yet been addressed. We'll also include the important questions that haven't been gotten to yet today. We'll try to answer more of those over the next week or so on our FAQ page. So Anne-Marie, do you want to ask the first question?
Yes, I want to ask the first question. The first question, we've had many questions about this. What about fish oil supplementation for someone who has COVID-19 or for someone who does not have it for prevention?
Well, I'll start and then anybody else can join in. So I think fish oil has a potential role. Of course, you know, the caveat to any of my answers is we don't know for sure in relation to COVID-19, but the mechanism, the anti-inflammatory mechanism for fish oil is a little bit different than that of the flavonoids that I mentioned. It works on a different pathway, which is the arachidonic acid pathway, and that downregulates the inflammatory compounds out of that pathway, and that actually has some potential benefit in this scenario, and it gets into a little bit of a complex biochemistry having to do with the mitochondrial health. But I do think that there is a potential role for fish oil as a anti-inflammatory compound. Yes.
Thank you, Lise. I have a question for Andy. There's a question about the best use of melatonin. Would you recommend it for prophylaxis or would you reserve it if you actually became sick?
I would recommend prophylaxis. And I myself, relatively high dose of melatonin for quite some time. All of the melatonin researchers that I know take it themselves, often in significantly higher doses than people take for sleep, and they get more bolstering defenses against cancer and infection. I think melatonin is completely harmless. The only adverse effects I know are that, people, it causes nightmares and they can't take it, and people it just remember dreams.
Thanks, Andy. Anne-Marie.
I have a question for Esther. Does wearing a mask increase CO2, and do we need to worry about that?
That's a really great question. We're actually looking right now in my lab at ways to measure CO2 and the CO2 bubble. We did discover a CO2 bubble that we all carry around with us. And I would say, I don't know the answer about masks, but certainly if you are sitting in one place, the CO2 that you breathe out tends to accumulate. So the masks are not completely airtight. Obviously, that would cause an increase in CO2 that would be suffocating. So masks in general are made to be able to breathe in and out. And so I would say that it's a great question. It's something we are looking into in various ways, and walking around or moving from one place will help.
I have a question for Randy. There's a lot of questions about ACE inhibitors, which, as listeners know, are often prescribed for people with high blood pressure. Safe, not safe? Should you get off one if you're on them?
Yeah, the problem is we don't know yet. That's the big problem. You know that the ACE2 receptor was used, as you saw in my talk and Lisa's talk. ACE inhibitors are antihypertensives in the angiotensin system. What they found in animal models and other models is that when you treat someone with an ACE inhibitor, ACE2 receptors can go up. Whether that's linked to increased susceptibility to viral disease isn't clear yet. They're doing studies, they're controversial. Half say yes, half say no. The wisdom right now is if you have a new patient newly diagnosed with hypertension, pick a different agent. There's 20 to choose from. If you're already on an ACE or an ARB, stick with it for right now.
Thank you.
I have a question for Andy. For someone who's juicing, what would be the best procedure to wash the fruits and vegetables, and should they wait a few days before they use them?
First of all, I mostly recommend juicing vegetables, not fruits, because fruit juices are concentrated sugar sources. You may wish to peel vegetables, like carrots, if you don't know where they came from. Otherwise, I think washing vegetables, there are various sprays and cleaning solutions you can use, but they tend to be expensive. I think you use just an ordinary, a drop of dish detergent in water and wash vegetables and then rinse them well. I wouldn't worry about picking up virus from handling food in general.
There's another question that I think, Andy, you would be best to take, and that's pros and cons of cannabis right now. And the questioner specifically said, obviously not smoking it.
Yeah, I don't know that I can give an answer to that. I think cannabis affects different people in different ways. Some people can use it to help them sleep. Other people find it stimulates them. So I think if you're using cannabis for some particular medical purpose and get good results with it, I would continue doing that. I don't have any concerns about that.
I have a question for Lise. What's the difference between an isolated polysaccharide from medicinal mushrooms and mycelium mushroom extracts? And can you give us some examples?
Yeah, it's a good question. It's a bit confusing. So a lot of actually, to be fair, most of the research that we have on medicinal mushrooms is actually done on a component that's been pulled out of the mushroom and stabilized. So these are things not available anymore, PSK, PSP. Those actually really form the bulk of what we know about medicinal mushrooms. Those are isolated polysaccharides. What is still available are isolated beta-glucans from mushrooms, lentinin from maitake mushrooms. So those isolated polysaccharides, which are, again, pulled out of their context of the whole mushroom, could be contraindicated in this situation because they actually upregulate many of these inflammatory cytokines. When you use the whole mushroom extract, so you're getting these polysaccharides, but you're also getting the flavonoids found in mushrooms and some of the other vitamins and minerals. The mushroom has an immunomodulating effect, and as I mentioned in my slides, downregulates excessive inflammation. So those would be much safer.
Very complicated, and you really have to dive deep into the mushroom literature, but I think this is also addressed well on our frequently asked questions page. Here's one for whoever feels ready to answer it, and that's, is there any value to hyperbaric oxygen chambers in face of this infection?
Boy, that's interesting because ARDS is one of the rare side effects of hyperbaric oxygen. If you look in the literature, I think you'll find that's what we tell patients. We warn them about that. But I do know that there's a study going on. I don't know who's doing it, but there is a study looking at that now.
Speaking of studies, what about intravenous vitamin C?
I have only recommended intravenous vitamin C for patients recovering from surgery. I think it speeds wound healing. I really know nothing about its use in this situation. Lise mentioned that vitamin C may have a prophylactic effect. I don't know, Lise, do you have any opinion on that?
Well, there are some studies in progress in China using intravenous vitamin C. From an intravenous perspective, they're fairly low. They're almost what we call pushes. They're like 20 to 40 milligram doses, which is certainly much more than we can get orally. And in the preliminary anecdotal reports from those researchers, they're reporting that people recover from COVID-19 more rapidly and more fully. But again, this is still in research stage, so we just don't know the answer yet.
You mean 20 grams, not 20 milligrams, yes?
Did I say milligrams? I meant grams, yes.
Okay.
Here's a question about people with autoimmune disease. Are they at increased risk, and what would you do, or what would you tell them?
Yeah, I think that there may be a slight increase, but based on the data we've seen, it's the people who are taking immunosuppressants for those conditions. Those are the people that may be at slightly higher risk or even moderate risk. So the presence of an autoimmune condition yourself, if you have one, probably doesn't elevate you to a high risk category, but depending on the medications you're taking, that may push you.
Okay, I have a question for Lise because it's been asked many times. What about oregano oil?
Yeah, oregano oil I think has potential. You know, oregano oil is very antimicrobial, including antiviral. It also has anti-inflammatory properties. And it's widely available as a dietary supplement for internal use. It's primarily used for gastrointestinal infections and to help normalize the microbiome. So how much of the oregano oil essential oils circulate to the lungs, for example, is unknown. So we don't know for sure. Traditionally, oregano as a plant, as an herbal medicine, has been incorporated in respiratory tract formulas. So I think there's certainly indication that it has benefit as an antiviral and as an anti-inflammatory agent. I don't, in terms of the benefit-risk ratio, I don't really see a high level of risk with that either.
Lise, I have more faith in thyme essential oil for those purposes, especially for inhalation. I think that can be useful as, prophylactic and treatment for upper respiratory infections. So you can put some oil of thyme in a pot of water, boil it, and put a towel over your head and inhale it. I think that's very useful.
Yeah, I 100% agree with you. Yes.
So I have one final question that I'm going to ask Andy to answer first, and then anyone else who wants to add another tip can do so. And then we will close. I do want to say before closing that this has been recorded. The recording will be available. We will try to address many of the other questions. We know there are so many additional questions on our frequently asked questions page. We're so grateful to everybody who came for this, over 1,000 people, and from many, many different countries, including India and Chile and France and Canada, Dublin and Ireland. So thank you so much for joining us. And I think that to end with, we are seeing, of course, terrible rates of infection, but we're now seeing more and more people who have gotten to the other side and are recovering from coronavirus. And so, Andy, what would you tell people to do from an integrative medicine perspective to really enhance their healing as they are recovering from the infection?
You know, I think all the things we've mentioned before, pay attention to good nutrition, plenty of vegetables, for example, a plant-forward diet, get regular, moderate physical activity as tolerated, get rest and sleep, practice good mental nutrition, very careful about what you let into your mental sphere, find ways to laugh, connect with nature. Take some of the supplements that we know are useful, like antioxidant supplements, possibly some of the safe herbal remedies like astragalus. I think that's all just basic, sensible advice that integrative medicine can give, and trust the body's healing response. You know, people get better, and that's the remarkable thing. And, you know, even looking at this particular infectious disease, the vast majority of people who contract this seriously sick. You know, we don't hear about all of that. And many people are able to tolerate this and get over it relatively quickly.
Thanks, Andy. 5 seconds from the other. Yes, Anne-Marie.
I would add a mind-body practice because of the way that we're living right now. Insight Timer is wonderful. We have some on our website, but using guided imagery, meditation, or some form of mind-body medicine.
Thank you. Randy.
Deep breathing exercises are great as you're recovering from this. Don't let the lungs collapse. Deep breathing, and don't push yourself with exercise.
Lise.
Well, I'll just stick in the supplement range, and the two herbs that come to mind for me in the convalescent stage is an herb called boswellia, and also something called, we talked about this, astragalus. Those two together, I think, have really beautiful anti-inflammatory and lung strengthening actions.
Thank you. Esther.
And Lise, can I add, I would also recommend the mushroom cordyceps, which traditionally in Chinese medicine has been used to help recovery from illness and injury and debilitation, and has a specific effect on aerobic capacity. It's quite harmless, can be taken long term.
Thanks, Andy. Esther.
I would just say find ways that you can, in your own world, turn your bad stress into good stress and help others, and turn your home into a healing place.
Thank you so much to all of our amazing faculty at the Andrew Weil Center for Integrative Medicine. Just so grateful for you and for all of the efforts. Read on our website the resources that we have put up. We have put a PDF of the slides up on the chat so you can get that. And we really pray that you will all stay healthy and safe. And thank you to the all of the health professionals who are online, who are providing care in this incredibly challenging time. Thank you. Thank you for your service at this time.